Driving high is never okay.
This is Rogers TV, Barrie.
Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with a COVID-19 update for Simcoe Muskoka. So it has been since March 23rd since I last provided an update. And since that time, we have surpassed 40,000 confirmed COVID cases in total since the beginning of the pandemic for Simcoe Muskoka. We've had a total of 532 cases over the last 3 days, 170 cases a day. This actually takes us to late January, when the last time we would have had an incidence that would be similar to that. Over the past 4 weeks, we've surpassed. Okay, if I could ask people to mute, please. Thank you very much. So over the past 4 weeks, we've remained higher than the provincial weekly incidence on a per capita basis. The Chief Medical Officer of Health, Dr. Kieran Moore, had indicated in his press conference yesterday that we are in the 6th wave of the pandemic. During the week of April 3rd to 9th, we had a total of 1,284 cases. This is giving us an incidence of 208 cases per 100,000 population per week, and that's up 17% from the previous week at 1,095 cases. If we go over the last 2-week interval, we're actually up 79% in our incidence of cases. So as it indicated, the last time we had an incidence that was at this level of elevation was January 23rd. And it's worth noting that the highest incidence we ever had was on the 31st of December, 2021, at over 700 cases per 100,000 population per week. So much higher, actually. The province has a lower incidence per capita than ourselves right now at 148 cases per 100,000 population per week, and their incidence increased by 22% over the week period. We note with regards to our cases that 16% of them were for the week of April 3rd to 9th, 16% of them were unvaccinated, 83% had had 2 or more doses of vaccination. And I think it's important to also note that 57% of our cases had 3 doses of vaccination, so a booster dose, more than 14 days before the onset of their illness. So I think it's very important for people to know that vaccination is important, but it is not going to be totally protective, and that people have to take other precautions as well as be fully immunized, as well as have received all vaccinations for which we are recommending, for which they're eligible, but go beyond that and practice other protective measures in order to reduce your risk. We do note that since December 12th to April 10th, those who are unvaccinated are 3 times more likely to be hospitalized than those who've had 2 or more doses of vaccine, and are 5 times more likely to be admitted to the intensive care unit, and are 3 times more likely to die. So very important that people be immunized and receive all doses, be up to date with your immunization, but not to rely on that alone, and practice the other preventive measures as well. Our percent positivity is 20.2%, up from 16.5% a week ago. And this is compared with 19.4% for the province. So we are slightly higher than the provincial percent positivity. And this is an indication of both the amount of transmission happening in the community and the availability or accessibility of tests for people. So literally, it is the percent of tests that come back positive. So anything above 3% is of concern, certainly 20% very concerning. Hospitalizations have been up a little over the last 2 weeks. So 2 weeks ago, there were 17 hospitalizations among people in Simcoe Muskoka versus right now 22, and 3 in the intensive care unit, which is unchanged over the past 2 weeks. So although we are seeing a sharp rise in transmission, we're not yet seeing a sharp rise in hospitalization or ICU admission. That does tend to lag. So you'll see a rise in transmission in the community before you will see whatever rise occurs in severity and hospitalization. You'll see that delayed in the range of 2 weeks. So if we look at the characteristics of those who are hospitalized at this time, 11 are female, 11 are male. Their ages range from in their 40s to their 90s. All of them are from Simcoe County. 20 of the 22 are sporadic cases, 2 are associated with institutional outbreaks. 14% of them were unimmunized, 41% of them had 2 doses of immunization, and 45% had received 3 doses of immunization. And we have had on average 5 deaths per week since the week of February the 27th. And at this point have a total of 439 deaths. We have an additional 9 deaths over the past 2 weeks. And I would like to express my condolences to family members of those who passed away for your loss. So they consist of 5 males, 4 females, 8 from Simcoe County, 1 from Muskoka. 3 were associated with institutional outbreaks in 2 outbreak settings. 2 were unvaccinated, 3 had been vaccinated with 2 doses, and 4 had been vaccinated with 3 doses. And their ages range from in their 50s to in their 90s. We do have an increase in our outbreaks in settings for which we are monitoring. So those would be healthcare institutions, long-term care facilities, retirement homes, other congregate settings like group homes, and childcare centers. So outbreaks in other settings in the community, we aren't able to track. So we have 51 of settings for which we track an outbreak, up from 33 2 weeks ago. 20 of them are in congregate settings, up from 10 2 weeks ago. So 14 in group homes, 4 in shelters, 2 in other congregate settings. 22 are in institutions, up from 16 2 weeks ago. So 11 are in long-term care facilities, up from 10 2 weeks ago. Now, I'm sorry, if people could please mute, that would be helpful. Thank you very much. 9 are in retirement homes, up from 5. 2 are in hospitals, up from 1 2 weeks ago. In terms of immunization, we have a total of 86% of those who are 5 and above. So the eligible population, 86% of those that had 1 dose, and 83% have had 2 doses. And both of those are up by a percentage point compared with when I last reported. And 50% have had 3 doses, up by 1 percentage point since I last reported. We've just commenced with fourth dose boosters. So it's actually a second boosters starting last Thursday. However, there were other individuals who had received a fourth dose, those that were in long-term care facilities, had been offered and most received a fourth dose. Those who were immunosuppressed and had a 3-dose initial series followed by a booster had received a prior dose. So we've had a total of 8,080 individuals in Simcoe Muskoka that have received a fourth dose to date. There were 1,674 fourth doses administered in Simcoe Muskoka, April 8th to the 10th. And more than half of these, about 60% of them, were administered in local pharmacies, and 335 were administered at the mass immunization clinic at 29 Sperling Drive, with an additional 1,428 fourth dose appointments booked up until April 24th at that location. I do want to commend pharmacies for their contributions, commend RVH for their contribution running the 29 Sperling Drive location. And I would also like to commend Aurelia Soldiers Memorial Hospital for their clinic, in which they've provided 120 doses of fourth doses for those 16 above eligible for booster doses since last Thursday, and also my own staff working at the clinic in Georgian Mall at 191 doses. We've had some continuation of administration of third doses, and I really want to take this moment to advise people to get all the doses for which you are eligible to receive. So it's not too late for people to come forward and commence if they haven't received any before, or to catch up with all that they're accessible to receive. For third doses, 54% of the population eligible, 12 plus, have received it in Simcoe Muskoka, and 73% who are 50 plus years of age, 85% of those 70 plus years of age have received a third dose. And for pediatric doses, those 5 to 11 years of age, 49% of our pediatric population, child population in that age group, have received their first dose of immunization. And we continue to provide vaccination to that population as well. A total of 348 pediatric doses were administered on April the 8th to the 10th. In terms of wastewater surveillance, we note that the overall surveillance being conducted and posted by the Ontario COVID Science Advisory table on their website, their dashboard, indicates that for the Central East region of the province, the wastewater signal exceeds what it was at the height of the 5th wave, the Omicron wave, in December and the beginning of January. And as for our own 4 municipalities that we are monitoring in Simcoe Muskoka, 3 of them, Barrie, Midland, and Aurelia, over the past week have had an upward trend in their signal. They've not reached the level that they've been at the end of January yet, but we do have a week delay before we get the results on those. And for Collingwood, which we've been taking samples readings once a week, have had some spikes in elevation, but more difficult to interpret. Okay. And in terms of our dashboard, we remain in red status. We've been in red status for many weeks throughout since before the Omicron wave in late November, December. And one indicator that has gone up has been acute bed occupancy in our hospitals, which is up to 93.8%, elevated from 84.2% when I last reported 2 weeks ago. One other thing I would indicate is that I have been informed by hospital leadership in Simcoe Muskoka that there's a high degree of staff illness related to COVID-19, and that is proving to be challenging to them at this time, and it's important for the public to be aware of that. And that'd be another reason why we all need to do what we can to avoid, through a multi-layered approach, to protect ourselves and protect those around us and help reduce transmission overall. So Ontario is in its 6th wave of the pandemic, and we've locally seen indications of elevated transmission with our case count, incidence of cases, our wastewater monitoring, and our number of outbreaks. So far, hospitalization and ICU admission have been stable, but we would expect that to lag. We don't know the degree to which that would be expected to be impacted, but I do expect some elevation to occur in the near future. We do note that this elevation in part has been related to the arrival of a new subvariant of Omicron, BA2, which is more transmissible. Also related, though, to the removal of public health measures as actually predicted, including by the province, that there would be some elevation. I've already indicated that I have received verbal communication about impacts on staffing in healthcare facilities. I've seen that to some degree as well in other congregate settings. And we are seeing an increase in outbreaks in facilities, noting impact on our overall healthcare system and care system. And therefore, I'm going to reiterate recommendations that I've been making consistently throughout the pandemic, and certainly stated and positioned with a community letter on March the 23rd, in which I indicated that at that time, even though we were coming off of the 5th wave, there was a high degree of transmission and the potential for elevation in the future, and that the pandemic continues, and that we need to be aware of that and be cautious in our lives. So although requirements have been lifted for immunization, for mask use, for physical distancing, that I continue to advise that all of those things happen, that people take on for themselves, maintaining these multi-layered approaches to reducing transmission, protecting yourself and protecting those around you, and helping to reduce transmission overall, helping to curb this 6th wave that is now happening. And so this does include immunization and receiving all doses of immunization for which you are eligible, and using high quality mask in indoor public settings and work settings on a consistent basis, recommended for all people to do this. Physical distancing, 2 meters when possible, hand hygiene, hand washing, alcohol hand rub, self-monitoring and isolation if you develop symptoms, seeking testing, noting that there's a protocol as to who is eligible to get PCR testing at assessment centers, but more broadly, people can also seek testing with rapid antigen tests for themselves. And isolating if your case have symptoms or are a contact of a case, and contacting us for advice, having a look at our website for information about all of that would be very important. I note that there's now an opportunity for some to get a second booster, a 4th dose, those in Ontario who are 60 years of age or older, or those who are in the Indigenous population or live in a household with people from the Indigenous population who are 18 years of age or older, are eligible to get a 4th dose 5 months after their 3rd dose or after their 1st booster, is the recommended interval. It can be as short as 3 months, but we do recommend 5 months. We have a number of locations in which people are able to get their vaccination, whichever dose it would be. So community pharmacies right now have been providing the majority of vaccination. Once again, I want to commend them. We have our remaining clinics, one being run on an ongoing basis since the very beginning of the pandemic by RVH at 29 Sperling Drive, another with Soldiers Memorial Hospital, one being run by the health unit out of Georgia Mall. We have the GoVax bus. People can have a look at our website about these various locations, times in which they're available, and ability to access for the GoVax bus and for the health unit location at the Georgia Mall. Drop-ins are the way that we're going with that rather than bookings at this time. And as I'd indicated, I recommend all who are eligible seek out immunization. There may be some family clinics that are also participating in this. So people have a variety of options and do come to our website to have a look at what those options are. I've already spoken about additional precautions beyond immunization, just to reiterate their importance. And that it's really up to us to do these things because they are not enforced, they're not required, but they're very important to do. And going into holidays, a holiday weekend coming up, I think it's important for people to be mindful of gatherings and to choose for yourself ways of reducing risk. So beyond your household, there is an increased risk of transmission. If you bring others into your household, be aware remote connection with people is always safest. Outdoors is much safer. Also physical distancing where you can for indoors, fresh air where you can for indoors, use of masks, if in doubt, is always a way of reducing risk, even when you consider the kind of holiday gatherings that you can get into. So at this point, I'm just having a look at some questions that have arisen. There was a question with regards to, this is from social media, the preferred brand for fourth doses. And so mRNA vaccination is what's recommended, either Moderna or Pfizer. And we do have a lot of Moderna right now. It's particularly helpful for the older population, 70 plus. We're getting a good, robust immune response. So we're going to be preferentially offering that, but we'll provide Pfizer if demanded by individuals who are attending. So at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. As you said, we will now take some questions from the media. As always, we do ask those who are participating to limit themselves to one question and one follow-up in consideration of time. Can we start with Mary Beth Hartle from Muskoka Region? Do you have a question this afternoon?
I do, thank you. Dr. Gardner, last time you spoke, and of course it was before we proclaimed it was the sixth wave, we spoke about hoping that things would settle out by late spring and into the summer. Are we still projecting that, or is this just changing the whole picture?
I do know that the Ontario COVID Science Advisory Table is looking at more projections, another model, and expect a release of that in the near future. But even I think it's important to note that Dr. Kieran Moore had cited that with the rise in transmission that we're seeing right now, you're likely to see this affect the next perhaps 6 weeks anyway. We shall see, but I think we're looking at a wave that's going to significantly impact the spring. What follows that, I am hopeful we would be back into reduced numbers again for the summer, but I cannot know for sure.
Okay, thank you. And the other thing was, I know that you had kind of started to transition staff back into their regular roles. Is that changing?
We've transitioned a number of them. We put that on hold, so we're not continuing that, and we're keeping staff who've been redeployed and not transitioned back to their programming where they are with regards to case and contact management and vaccination.
Okay, thank you very much.
You're welcome.
Chris Simon from the Barrie Advance, do you have a question today?
I have a couple. Hi, Dr. Gardner. I've missed you. Are we at the point in this wave where, while this may be unpopular, we need to look at reimposing some stricter public health measures? And if so, what would those look like?
So we are seeing a rise in the past with the other waves. Other measures have been put in place and have helped to blunt the rise, control the rise, bring it back down under control. But I also would note, I think there's a tremendous amount of fatigue in the public, and I think with each wave, it becomes more and more difficult to be able to do that, whether it's done locally or whether it's done by the province. So we're trying messaging and positioning and education for people. And I am in ongoing discussion with my colleagues across the province and with the Office of the Chief Medical Officer of Health about the potential to go beyond that, but I do know that it would be very challenging.
Okay. I know that fourth doses are starting to roll out locally in Simcoe, Muskoka. When do you envision them being broadly available? And then I guess what would that rollout potentially look like? Would we see community clinics, reopening, that type of thing?
So we're getting a pretty good uptake. We're able to keep up with the demand that there is so far. It's limited in that it's mostly for those who are 60 plus, otherwise Indigenous population 18 plus. So it's a limited population to begin with. And it's also limited by time. We're advising that it be for those who've been 5 months since their first booster. And so that leads to it being staged over several weeks. At this point, we're also seeing that pharmacies have done a very good job offering and providing more than half of the doses so far. So we're prepared to increase the hours, number of staff at the clinics that we have. We're prepared, if necessary, to open up some clinics in our offices across the province. That's not something we've been, I should say, across Simcoe, Muskoka. That's not something that we've been doing so far. So we're looking at that as another way, if needed and when needed, to open up capacity. But so far we're able to meet the demand that's there.
Okay. And one more question, if I may. Can you just talk about to what extent the health unit is seeing the Omicron subvariants in the region?
So there is a weekly report put out by Public Health Ontario about the subvariants. Was one that was put out last Friday that had data from 2 weeks before that, basically late March, that itemized and looked at the proportion of COVID-19 that was particular subvariants. And that particular report indicated that at that time, 54% of COVID-19 was the BA2 variant of Omicron across the province, that it varied somewhat between health units, that it was quite a bit higher, but 10 percentage points higher in health units in the Greater Toronto area. And if I recall correctly, Simcoe, Muskoka, we were just under that provincial average. And then when you move out to more remote locations farther north, it drops off considerably.
Thank you very much.
You're welcome.
Can we go with James Bowler from Cogeco? Do you have a question today?
Thank you, I do. Dr. Gardner, would like to get some context here on what we're seeing, because we're back in the situation of saying Simcoe, Muskoka, and we know in past instances, Simcoe tends to be the bigger issue. So for all of our people here in Muskoka that are, listening, watching, whatever, really wanted to get an idea of what we're facing here versus Simcoe, because I'm assuming these higher numbers are probably the Simcoe area.
So we're challenged now in having data that takes you down to lower tier municipalities or even Simcoe versus Muskoka, and for the most part, not able to give you an answer to your question. But I did note that there was think, a significant difference in the percent positivity being higher in Simcoe County than for the District of Muskoka. Well, actually, it varies quite a bit. So here we go. Percent positivity is actually highest in South Georgian Bay area, 24%, and lowest in Muskoka at 13.7%. Versus for the district as a whole, Simcoe Muskoka at 20.2%. So that would be, I guess, one figure that I have for you that would show a differential between Simcoe versus Muskoka. But other than that, I'm afraid I don't have the data to be able to make a differential pronouncement about Simcoe versus Muskoka. And I do note that there's been plenty of transmission all over the province, including in Northern Ontario, where those health units have actually had the highest incidence of COVID-19 in recent weeks.
And my other question is, and thank you for that, that is helpful. My other question is just regarding these numbers versus the severity, because, before what we were looking at was, ICU numbers really being impacted. From the perspective that I've seen right now, it doesn't seem to be that ICU is getting as impacted. Would you agree with that? And does that play a role? Obviously we don't want people getting COVID, but does that play a role in how seriously we take what is happening now? Because we know that this virus, the death rates have been going down with it.
It's a mixed picture, right? So, just like with the BA1 variant, subvariant of Omicron in December and January, it was recognized on a case-by-case basis to be less severe, but because it was so much more transmissible, 5 times more transmissible than previous variants, such as the Delta variant, it resulted in a lot more people being admitted to hospital, a lot more people in the intensive care unit, and a significantly higher mortality on a week-by-week basis compared with earlier in the pandemic. So case by case, less severe, overall impact on the population, more severe. That's what we saw with the first wave of Omicron, the 5th wave of the pandemic. Now you have a new subvariant of Omicron. We're having a 6th wave. We're having a lot of transmission going up quickly. So far, we're not seeing locally a large increase in hospitalization, but that always lags, and we shall see where it actually goes given enough time. And I do note in the province, the level of hospitalization is higher than what had been predicted by the science tables projections that were released on the 17th of March, higher than what they would have predicted at this time. So we do need new projections from the science table about where this could go for severity. Mixed picture, complex picture. Still potential for a significant impact on hospitalizations.
Thank you.
You're welcome.
Deepak Bidwai from Barrie Community Media. Do you have a question this afternoon?
Yeah, thank you. Philadelphia. Excuse me. Yeah, Philadelphia in the U.S. Recently, maybe yesterday, I think they reinstated mask mandate in the city. So, as a major healthcare institution in Simcoe, Muskoka, do you have any recommendation for the city of Barrie or other region to reinstate the mask mandate?
I personally believe it would be helpful. It would be part of your multi-layered approach. So people will need to take upon themselves and do as much as they can to reduce risk through immunization, accepting all the doses that they're eligible for. If we had a mask mandate that would probably prompt more compliance with mask use, probably have some impact on transmission, although it may be limited compared with everything that's happening right now. But it would probably have some benefit. I don't know what the reaction of the public would be. We might get a strong negative reaction to that. That might impact on compliance. And I don't think that there would be, at least at this point, public tolerance for other measures that have been put in place in the past, other things such as restrictions on occupancy in businesses, that type of thing. So, back to your question, requirement for mask use might be helpful. And I know that a number of my colleagues are supportive of what we can do to augment mask use. But it would have to be in the context of everything else that we need people doing, getting vaccinated and physically distancing and isolating when they develop symptoms of their contact of the case. And all of that would help reduce the rise, but I anticipate we will still see some rise even with those measures in place. If we don't have those measures in place, the rise will be, I think, substantially higher.
Yeah, and just a question regarding just today, Toronto Star, published a news about universities in Ontario are pushing ahead with the in-person exams. So just in terms of the Georgian College, which has, especially large international student population. So in terms of that, do you have any recommendation or any advice for Georgian College? I'm not sure if they are holding in-person exam, but I'm trying to understand if they do any advice for them. And in addition to that, do you have any numbers on international students when it comes to COVID-19 positive rate?
Mm-hmm. So we don't have a breakdown by groups with regards to origin. We have data with regards to age. When we had a wider spread, broader testing happening in the community, we were able to break it down by local municipality, but not by origin of individuals. We've been able in the past to do analysis based on socio-demographic characteristics of neighborhoods, but we're not able really to do that now because of the change in the testing approach. So I wouldn't have an answer with regards to that. I certainly would be advising institutions to do what they can to reduce risk. Remote is the safest way, if not that. And certainly if present, optimizing ventilation, physical distancing, mask use, hand hygiene, and people screening and excluding themselves if they have symptoms or contact of a case. That all of those things would need to be augmented and supported to reduce risk by facilities, agencies, institutions.
Thank you so much, Doctor.
You're welcome.
Erica Engel from Collingwood Today, do you have a question?
Yes, thank you. Dr. Gardner, my question is, I'm hoping you could talk about the vaccinations. We're up to 4 doses now for a lot of the population. How sustainable is it for people to be getting doses of this vaccine every 140 or so days?
I certainly would acknowledge that it is new to be doing this kind of thing. If you compare it with influenza vaccination, that's an annual vaccine. And so this is working out to be quite a bit more frequent than annual. Going forward in time, I cannot predict the pattern, but I would acknowledge that so far we've really been recommending quite a significant amount of vaccination for people. And although I have no doubt that immunization has saved many, many lives around the world, in Ontario, in Simcoe, Muskoka, that, for example, the Omicron wave would have been, as big as it would have been very substantially worse if we hadn't had a high level of vaccination of the population. And the science table, Ontario COVID Science Advisory Table, put out, one of its reports on modeling that also looked back at the amount of hospital admissions that were prevented and ICU admissions that were prevented with the booster doses, the first booster dose that was conducted largely in December, and found that it was in the range of some 30% reduction compared to what would have occurred for hospitalizations without it. So important to do, but I would acknowledge that it is asking a lot of people. also asking a lot of the providers as well, whether it be my own staff, public health, the two hospitals that are participating in now, the community pharmacies and primary care.
Thank you. Sort of along the same lines, without it, unlikely there'll be mask mandates or capacity limits again, as you were saying earlier. So what would you say to people who are feeling sort of that this is all a little bit futile, that they're, they still get it even if they're being careful, because maybe others aren't being as careful?
It's tough, no doubt. It's been already a very long pandemic, and I do not know how much longer it will go on. And I think we need to think in terms of it could go on yet a long time. And that is extremely hard to take because it's required so much of us in the way of restriction on our lives and quality of lives and education and work and loss of work and loss of income. I do believe that there would have been much more loss of life without all of us doing what we've had to do to date. And certainly immunization has been critical things as difficult as they've been and are now. They would have been far worse without the vaccination that we've had. And so it has made a difference in terms of prevention of disease and illness and death. But it continues to be really hard on people. And I just want to recognize that and try to encourage people to continue following the advice that we're giving and following whatever direction may come in the future. It needs to be a two-way communication. I think we need to understand in public health, decision makers, provincially as well, how the public are faring with all of this and what they need in the way of information and supports to be able to manage all of this.
Thank you.
You're welcome.
Matthew Riesler from Moose FM, do you have a question this afternoon?
Yes, sorry. Thank you, Dr. Gardner, for doing this again. Further to a couple of my colleagues' questions, I'm curious if you think, because the last time we spoke, I believe it was 2 days before or after the mask mandate was due to be lifted. Do you think it was lifted a little too soon in Ontario?
Yeah, it was 2 days after the mask mandate was lifted. I spoke on the 23rd of March, and I put out my statement to the community, positioning that the pandemic isn't over. At that point, it looked like things were doing okay, but that people needed to take on themselves the multi-layered approach, including wearing masks, because the requirement to do so had been lifted. And I think I've been fairly open and consistent all the way through that I felt that things were happening earlier than I would have advised. The lifting of public health measures in general were happening earlier than I would have advised.
And you mentioned too earlier that there usually is a lag between a spike in cases and hospitalizations. So being that we're seeing a rather a large spike, as you said, currently in Simcoe Muskoka, are you concerned that the hospitalizations are going to follow? And is there anything that the health unit can do to potentially prepare for another large spike in hospitalizations?
I believe that we will see some rise in hospitalizations. I don't know how great it will be. The severity of it will depend on measures that people take right now to reduce their risk, getting booster doses that they could get right now, taking on for themselves the multi-layered approach with mask use and distancing, reducing out of household contact, and isolating with symptoms. So all of that's important and can make a difference even now for the amount of cases that happen, all the more so for those who are vulnerable, older people, people with pre-existing medical conditions, and immunosuppressed people, that these things can make a difference even now in terms of how how much more hospitalization, ICU admissions that we get, or people passing away. I think another question would be the degree to which the amount of immunization that is out there in these other practices reduces severity even among those who become cases. So all the more important for people to accept all the immunization that they have. They might become a case, but they're quite a bit less likely to have a severe case. It can certainly still happen, but their risk is quite significantly reduced if they've had all the immunization that they can get. So I encourage people to do all that they can to reduce the risk of becoming a case or becoming a severe case.
Okay, thank you, Dr. Gardner.
You're welcome.
Mark Claremont from Muskoka Today, do you have a question?
Yes, just on that follow-up also. So, Doctor, are you concerned about people getting COVID and not knowing that they have COVID or bothering to report the fact and just taking the sickness now for granted and becoming complacent about it?
We won't see the great majority of cases because they're not tested with rapid antigen tests and therefore entered into the provincial laboratory reporting system to local public health. So we won't know about the great majority of cases. It's really incumbent on people to do what they can to reduce the risk in the first place. And if they do develop symptoms, identify if they qualify to be tested. And what's really important is for those who qualify to be tested to do so because to go to an assessment center because there is treatment now. Paxlovid can greatly reduce the risk of severity for those who are high risk, the provincial criteria for who would qualify to receive that treatment. And so the assessment center system is set up to facilitate them getting that. So important for those who haven't been immunized, for those who have pre-existing medical conditions, those who aren't immunized and have pre-existing medical conditions and are older. Those are all criteria for receiving that treatment and therefore to be able to be tested. So important for people to identify for themselves if they fall in that risk category. They can certainly read about this on Ministry of Health posted information. Therefore, I think it's important for people to be aware of that risk. Otherwise, you'd ask the question, am I concerned that I don't know about cases? I'm not going to hear about the majority of cases, but I do urge everybody to take the precautions they can. And people can choose to also be tested with rapid antigen tests. That doesn't require you to go to an assessment center. So that's another option for people. And it does help them, I think, to identify to themselves and to their contacts if they've been a case about isolation. Certainly, there are a percentage of people who won't have symptoms. There've always been a minority of cases. By its nature, they're not going to know if they're a case, but if they've been in contact with somebody who's a known case, they do need to look on our website, look on the provinces, the Ministry of Health's website about precautions, required isolation requirements for those who are contacts, even if they don't have symptoms.
Thank you. And also you mentioned, I think you said that 50% of the people in the region do not have a third booster shot there. Are the new cases, I think you have some data that shows that those who don't have the third dose or people who are, I guess, unvaccinated for possibly the second and first, or you're up in the high 80s for those things. Is that where the problem is? And what are you doing to mitigate that so-called problem, if that's where it is there?
Well, there is no doubt that getting vaccinated and getting all the doses that you can reduces your risk of a severe case, being admitted to hospital, ending up in the ICU, or dying. So from our own data since December 12th through to April 10th, Those who are unimmunized are 3 times more likely to be admitted to hospital, are 5 times more likely to be admitted to the intensive care unit, and are 3 times more likely to die compared with those who've had 2 or more doses of vaccine. So important that people get their vaccine, but it's also important to note that we've had many people fully immunized, including those with boosters, who've had severe COVID-19 and died. So you have to get your vaccines, do the best you can about that, receive all that you're eligible for, but also apply the other multi-layered approaches to reduce your risk, including masking and distancing and self-isolation if you develop symptoms.
Just quickly, there was a number mentioned a couple of weeks ago of 100,000. And if that's the case there, is this region particularly severely hit?
So we do have a higher incidence per capita compared with the province, as I pointed out with the basic data that I provided at the very beginning of my presentation. And there is quite a range between health units about the per capita incidence of transmission of cases. And right now in the Greater Toronto area, it tends to be lower, and in Northern Ontario, it tends to be much higher. So Simcoe Muskoka is above the provincial average overall for transmission, but quite a bit lower than Northern Ontario, quite a bit lower than Kingston as well, which has a very high rate of transmission at this time.
Okay, thanks a lot.
You're welcome.
Is there anyone from the phone line this afternoon who'd like to ask a question? Okay. And finally, was there any member of the media who didn't have an opportunity to ask a question this afternoon?
Hey, Kara, are we going to see these briefings more often again in the next couple of weeks?
Dr. Gardner, do you want to speak to that?
Sure. So 3 weeks ago, I'd indicated that we wouldn't be doing regular briefings, but we would be doing them on an as-needed basis. And at this point in time, I don't have clarity as to when I'll be doing my next one, but I would reassure people that I will be available. We remain available. I've been available and done some interviews, given some information to the media over the last 3 weeks, as we have done so through the pandemic. So I don't have in mind exactly when I would be having another press conference like this, but it will be on an as needed basis.
Thank you, Dr. Gardner. I believe that brings us to the end of our media briefing. So once again, Dr. Gardner, thank you so much for your update and your time. And we'd also like to thank the media for your participation today.
Goodbye, everybody.
Recording stopped.
Get it. So I pulled that in. I also offer workshops about cool stuff. It's actually not called Cool Stuff, but this is the TV show and it's not my personal Zoom. And I invite in really great people who are experts in a variety of unique and fabulous topics to come and teach me things because I'm curious about all things. And again, building safe container. So you get to join every circle, every cool workshop, every course with the same community of amazing women and be reminded consistently, like every day, how awesome I think you are and how to be able to tap into that knowing for yourself and gain that work. The last sort of bit in I call it sort of the big kahuna is the inner circle. So also part of the Awesomeness Academy. It encompasses all the resources, everything I've ever offered with the one-on-one coaching. So it's a group program with one-on-one built in. Again, I want to, if someone's going to come to me, I want to be able to share with them all the resources they could possibly need and then guide them to the ones that are going to make sense for them.
That's awesome. And then correct me if I'm wrong. Do you have a kind of a retreat where women all come together and
Not right now.
No,
Not right now.
At some point you did host a...
Yes. So in the early days of my business, before I was still trying to uncover how I was going to show up. I knew what I knew what I was passionate about. I knew what I was excited about, and I knew that community and connection was absolutely crucial to my growth and survival as an entrepreneur, as a woman, as someone who battles the not enoughness. And I created an event called the 100 Women on Fire event. So it's an annual event. The first one was in 2019. It was fantastic. It was 100 women in a room, all just loving up on each other. Great speakers, great vendors, a really great day. The second one was slated for April 2020. Which of course didn't happen in that way. And I wasn't sure what to do with that. Again, because authentic connection is so crucial to me as in what I do, I didn't want to just flip it online and be like, it'll translate, it'll be great. I wanted to really create something that was going to make sense, even though it wasn't face-to-face, but someone could sit down at their computer and feel like they were in a room with 100 women.
Okay.
So it took me 6 months, but I did. And I combined it with the Awesomeness Academy. So all the guests of my event, which happened in October online, they could be in the academy for an entire month, get all those connection pieces